so much for joining us again this week. We are excited to bring you another industry professional from the entertainment industry, actually the sports and entertainment industry. This time it is in physical therapy. So I cannot wait to hear more about this career path. So let's go ahead and get started. Dawn, thank you so much for joining us today.
No problem. This is super exciting. Thank you for having me.
Well, would you mind taking just a few minutes to introduce yourself, tell us who you are and what you do?
Yep. So my name is Dawn Muci. I am a doctor of physical therapy, which is equivalent to like what a pharmacist is, that terminal degree. They're a doctor of pharmacy. So I'm a doctor of physical therapy. You don't have to call me doctor though. I've also got my athletic training certification. So I'm an AT, I'm a PT AT, which is kind of a unique combo. It's not super common. And I work at Cirque du Soleil right now. We're in Orlando at Walt Disney World. We're putting together a new show called Drawn to Life. We were actually hours away from previewing like an invited audience, our second invited audience of like 200 people, and the government shut us down literally within hours. So it's kind of weird because I haven't seen all the artists in such a long time. After putting the show together, we were in Montreal for about 5 months. Then we transferred to Florida. So kind of a weird time, this COVID time. And then so I worked at Cirque for almost 10 years. And during that time, I took a brief break and I worked at Stanford, dealing with a lot of concussions in the sports clinic. And then I also worked for the Women's Tennis Association. So Serena, Sloane, Madison, if you know all those names. But I toured with them for 4 seasons, and that was really exciting. I mean, I literally saw the world. So it was super fun being on tour with all these great tennis players.
Yeah. It sounds like such an exciting career. And, so many students have probably considered physical therapy before, but I bet there's so many different opportunities in that career field that's probably not well known. Would you mind taking a minute and talking a little bit about the different roles and positions or organizations that there's opportunities to work in physical therapy with?
Yep. So if you think any sports team basically they always have athletic trainers, especially at the high level. And if you're at the pro level, so football, baseball, basketball, they have a whole sports medicine team, which usually consists of athletic trainers, physical therapists, and strength and conditioning specialists. So everybody has their own little role. The physical therapists, especially at the higher sport level, tend to do all of the long-term rehab and the acute injury management. So it's definitely an interprofessional or like disciplinary role where we have to work hand in hand as a team. At the WTA, it's quite unique because we had physios from all over the world. So physical therapists, so Australian trained, British trained, even Chinese or Japanese, and then obviously Americans, Canadians. And, it's really, really interesting seeing all the different levels and like what people learn and what they bring to the table. So I learned so much from all these other physios. I didn't really know there was a place at tennis for a PT, actually. I worked with a doctor who's a medical advisor for the WTA, and he told me about the tour. And I was like, this sounds amazing because you're on tour, sometimes you're at a new city, even country every week. Sometimes you're in one, like if you do the US Open, you're there for like 5 weeks. So super, super cool to like be able to do PT in all these different environments. I think besides sports and entertainment, there's also like Amazon hires physical therapists. So in the industrial, there's quite a niche. There's athletic trainers, there's physical therapists that really do a lot of injury prevention because it's the same. People have to lift heavy things. That's what we have our athletes do as injury prevention. So it's just applying in all these different kind of departments. My very first job out of PT school was at Walt Disney World in their workman's compensation clinic. So it was only cast members that worked at Disney. They would be injured for whatever reason on the job. And then they would come over for PT, and that's where we saw them. So it was really, I saw like performers characters, the whole gamut, housekeepers, servers. So PT is quite applicable in all these different realms. So you can definitely like specialize in different places.
Yeah, that's very interesting. I've never thought about at Walt Disney World there having to be physical therapists. So I love that. So it sounds like to me that no matter what interests students have, whether it be in sports or entertainment or industry, there's a role that everyone needs a physical therapist. Like they could plug in somewhere that would fulfill that passion for them. So.
Yeah. And I mean, the sports and entertainment level, it's a little bit different because we don't, like, I know my patients very, very well. So I know their personality, if they're going to be able to tolerate pain or not, kind of how to manage that. In the clinic, when I worked at Stanford, we didn't necessarily know these people, right? They just came in, they're strangers, and I would get to know them. So I think the difference is, my life revolved around all of my artists or all my athletes when I was on tour. When I was in the clinic, it was more like, okay, I met these people. I had like 45 minutes to an hour to make an impact on their life. So it's a much different environment. Both are very challenging in their own realm, for sure.
Yeah. So could you tell us a little bit about what your daily responsibilities and duties look like just in an average day? And I'm sure every day is different. But what does an average day look like for you?
So it's interesting because most people don't realize that I work what's considered second shift. So I go in around noon to 2:00, depending on, because there's obviously other physical therapists that I work with. And then I work until the end of the show. So even though we didn't have a show, usually the show would end around like 10:30, 11:00, and then I can go home. So my 8 hours are like that 2:00 till 10 kind of range. So at Cirque, particularly, everything, like if we have an artist that's out for a long term because they need rehab, we do all that early in the afternoon. And then we usually have trainings where artists are physically training their apparatus, their skills. And then we have show call, do the 2 shows. Obviously, we have to cover the shows because they do quite dangerous acts. And then we get to go home. So before the show, like that 3 or 4 hours in the afternoon, that's when all the artists come in for their treatments. It's similar to an actual orthopedic physical therapy clinic. We have to have appointments. Some people have to be in, some people are rehabbing, some people are out of the show. There's that whole mix, but basically all the therapists, the whole performance medicine department is responsible for those artists.
Yeah. I mean, it sounds like you have a really cool job. I can't imagine what it would be like to work with athletes and artists, but I'm sure it hasn't always been that way. Just like everyone else, you've gone along a professional journey. So could you tell us how in the world did you get to where you are today?
Yeah. So I was really lucky. As I said, one of my first jobs after PT school was at the Walt Disney Clinic. And I just kind of happened upon it. I was working for a company that's actually not really in existence anymore called Health South, which was a really busy orthopedic clinic. I mean, we were supposed to see 3 to 4 patients an hour, which is difficult to give really great care in that very short time when I have like 3 other people asking me questions. And so this opportunity came up for the Walt Disney Clinic, and I jumped at that. And then things just kind of fell into my lap. As in, then I moved to the Lion King in New York through Disney, which was a whole great experience. And, looking back, I was quite young. I'd only been out of school for 2 years at that point. So I was still considered a new grad. And for them to give me that opportunity being so young was quite extraordinary. Like looking back, like there's things that I shouldn't have done. There's things I should have done. And then, yeah, from there, I got the job with Cirque, and Cirque is really, really good at kind of grooming their talent. So I remember starting with Cirque and thinking, oh, this is really cool. I can see myself doing this for about 5 years. And then I ended up being there for 10 years. So, and it went by like that because there were quite a few opportunities for growth. I went on tour. I became the supervisor of the performance medicine department. So I really grew as a person and an individual clinician. And I think, these big companies, they have a lot, if they invest in you as a clinician, it's really important. So I think looking back on my career, I was really lucky to work with these companies that were invested in me, versus like just kind of use me as a number, which some clinics might look at you as just like a money generator. But I think in general, that's kind of where my skills have been, I guess, gravitated to. I've been with those companies that have really invested in me. So,
yeah. So it sounds like you had a lot of opportunities at a young age. What would you say really attributed to you stumbling across those opportunities? Was it relationships? Was it your skill set?
I would like to say that I'm very like, I can manage in all these different environments and I'm very adaptable. But honestly, I think the biggest thing was I wasn't scared to say no. So I was in Florida, in Orlando, working. And then this job came up in New York and I interviewed and really, really wanted it, right? And I didn't even hesitate to say no. Like I was like, yes, I'll take it. I'll take it. And I had to move and I moved into, I had my own apartment in Orlando and I moved into a 3-bedroom with strangers in the basement, like with my dog. And so, I was young, it was much easier then, but I wasn't scared to like take those chances, because even if it didn't work out or, I failed, it would still look really good in the future. And I would learn as a person, I would grow as a clinician. So I think don't be scared to take that kind of jump off a cliff, because then I was at Lion King for a little over almost a year and a half. And then I went to Cirque. So I moved to Vegas. So it was like this whole, like, I didn't know anybody in Vegas. I didn't know anybody in New York. So it was terrifying. And at the same time, like it made me who I am. I mean, I think I have a little bit of like maybe a gypsy in me. I want to like travel a lot. And, I moved to California, moved from Vegas. I was on tour with the WTA and with Cirque. So I think that's something that's also really interesting to me. I like seeing new cultures, but definitely like don't be scared to like jump for that opportunity, because, so I find, especially when I have PT students, they're so scared of making a mistake. And I'm 100% sure I made tons of mistakes in all my jobs, even now. And you just have to like learn from it and say, okay, yeah, I made that mistake and move forward.
Yes. Oh my goodness. That is such good advice. And it's something that I wish I would have learned at a younger age, that when students are young, maybe they're right out of high school, they're right out of college, that is the prime time to take these big risks. And you never know what opportunities you will stumble upon. I mean, just like you didn't know anyone in New York, you didn't know anyone in Las Vegas. And I can imagine how scary that could be. But look at you now. Like, that is amazing.
I mean, it was a little bit harder. Even now I moved from San Francisco to Florida. You can't get any farther apart in the continental US. And I have a husband now. And so making that move was still like, well, I hope he can find a job. I hope he can, I hope he likes Florida. He's never been there. So it was, I mean, I just have to think like if nothing else, I'm going to grow from it. Like, yes. Even if I fail, like try it. You'll never know.
Absolutely. Everyone is going to fail. Everyone is going to make mistakes, and it's an opportunity for growth.
Right. So totally.
So in talking about failure or obstacles or overcoming things, what would be some advice that maybe you've lived by, or something that you could pass along to students of how you've overcome failures or obstacles along your professional journey?
Yeah. So I think one thing that I struggled with early on, and I still find myself kind of going back into this habit, is sometimes I will fixate on a mistake I made, or like I'll want to really right it. So like let's say I step on somebody's toes, like a coach, I tell a coach something that he doesn't necessarily agree with about an artist going back into the show. Instead of like disagreeing or like being frustrated that he doesn't agree with me, I just have to like accept that and move on. And I think early on, I was so worried about looking like I didn't know or that I was wrong. So I would like argue that. And I think I tried to really like, okay, this is where they're coming from, and really understand that kind of like, we're all going to disagree at some point. That's just the nature of working with people. And I can't fixate on it. Like, just if you make that mistake, you just have to move on. And then I had this a lot in various different environments, but I'm a female, and oftentimes even in PT, where it's a very female dominated career, in sports, there tends to be more men than women in physical therapy. And so it's been a little bit of like, okay, you're mansplaining, like I obviously know that. So I think as a female, you know, you have to be really careful so that you don't come across really aggressive. And sometimes I just have to bite my tongue and nod and say, okay, yes, and just move along, because it's not worth arguing or saying like I already said that or whatever. So I just think having that confidence of like knowing internally is more important than like proving to all the men that I'm dealing with and like let them have thinking that it's their idea or whatever the situation is.
Yeah, that is such a good perspective. And so many times that's hard for us as females to really embrace that. But you're exactly right. Sometimes it's just easier and better to choose happy.
Yeah. And I think, you know, I'm obviously older now, but I mean, I think I was a little bit aggressive as a young clinician. Like, I know this, like, I'm right. And so that's never going to end well. I mean, even because if he truly thinks he's right, it's just going to be a butting of heads. So, you know, that's just part of learning who I am as well. But yeah, letting things go for sure.
I love that. That is wonderful advice in so many different situations. So my next question for you is, you've worked in a ton of different, well, not a ton of different, several different organizations. You've worked in different industries, and I'm sure along the way you have discovered careers that you didn't realize existed. And that's one of my favorite questions to ask industry professionals is like, what have you discovered since high school that maybe a lot of high school students don't know are opportunities that are out there?
Yeah, the school I went to was very, very small, a high school. We didn't have a theater program per se until my junior and senior year, and it was just like an annual play. So I didn't know that in theater there's like stage managers and there's people who actually call the show, and there's like not only are there stage hands behind, but there are stage hands upon stage hands, like sound and lights, and I mean so many positions in the performing arts that I was not aware of. And then also in tennis, like literally tennis is a huge employer, and I had no idea. I mean, there's coaches that travel with each athlete. There's strength and conditioning. There's chair umpires that travel with the tour. And so they obviously I got to know them because they were on the tournaments too, and they travel. I mean, they're from all over, and like, what a cool job to just referee all these tennis matches. Like, so, and there's obviously at each tournament, we have supervisors for the managers, the bosses. I didn't know all that existed. And there's like literally tennis is quite a dominating, you know, environment. Like there's so many jobs. Even down here in Florida, there's a lot of athletes that train in the off season here because it's nice year round. So they can play tennis outside. And there's so many training places that I had no idea even existed. And I mean, there's PTs at those training spots. So yeah, lots and lots. If you want to work in sports, there's definitely opportunities.
Absolutely. I mean, opportunities are endless. And so many times it just really takes sitting down, observing, looking and seeing what these different roles and how these events or how these performances are coming together. There's a huge team of people that make it happen. So, and every single one of those roles is a career opportunity.
Yep. Yeah. I mean, you know, a lot of our artists at Cirque have toured with like Katy Perry or like Britney Spears, you know, all these names, and they have their own PT that travels with them as well. So, you know, I've never done that, but like there's definitely like a healthcare provider and all these roles. Like I said, even Amazon has an injury prevention healthcare provider. So
that's so interesting. I feel like I've learned so much just chatting. So my last question for you, and then I've got a few questions for from students is, what is some actionable advice of something that students could do today while they're still in high school to prepare them for a future career, maybe like you have?
Yeah, so I knew in high school that I wanted to work in the medical side, in like healthcare of something. I took an anatomy and physiology course my junior year and I loved it. So I already knew that I liked science. I was into like biology, I liked zoology, I liked all that stuff. But then anatomy and physiology just blew my mind. I was so interested in the body. So if you're interested in like healthcare, I think you need to take some basic science like biology, anatomy, physiology. And then, just little things like Amazon sells an anatomy and physiology coloring book. And I even have like 3 of them because I've gone through it so many times, but like, it's just fun for me to like visualize the body. I definitely am impressed with our human body. And pre-COVID, I don't know, clinics are a little bit weary about this now, but you could call a physical therapist and offer to volunteer under them. Clinics always, well, pre-COVID again, will take volunteers, and you basically can just hang out in the clinic. You can shadow clinicians. They'll make you, do laundry, clean the tables, pick up after the therapist, like put the toys away. But it's not a hard job, and you get so much exposure. And in fact, if you go on to PT school, that's one of the things you have to do. You have to spend so many hours in like a clinic, in the hospital, whatever these environments that you want to work in. And I remember doing it. I did it right out of high school because my neighbor was the physical therapist in the little town. And so I asked him, can I just go hang out? And he let me come in every Saturday morning. And so, the things that I saw were just blowing my mind. And then when I went on to college, I was like, I definitely want to be a physical therapist.
Yes. Oh, that is awesome. And it's something that's little, just asking if you can be there, just asking if you can volunteer or help in any way. And 9 times out of 10, people are wanting to support you. They want you to grow. And so definitely take that first step and just ask.
Yeah. I was lucky because, like I said, I was in a really small town. So my neighbor was the only physical therapist in the hospital. And he was like, sure, come on down. Like he was so excited to like talk to me and show me. So yeah, it definitely changed like my career path for sure.
Absolutely. So the first question that we have from a student is, are there differences? And if so, what is the difference between physical therapy for entertainment and physical therapy for sports?
Yeah. So the difference is there's a couple. I would say, and I've only worked at one professional sport, the highest level of tennis. So there's definitely a lot more pressure. There's a lot more press. At Cirque, we don't have media there every day interviewing our artists after they perform. In tennis, we do. So if somebody gets hurt on court, press will for sure ask them like what happened. They'll want to know all these details. So definitely there's a fine line between how much we can tell the press, or like we put out these things called media releases, how much they get to know. Like if you follow football, there's always like, the Monday update, the injury list, like all that stuff is already predetermined. Like somebody might say a knee injury, but you don't know how significant. So that was very unique to learn because like I remember my first time at the US Open, I had to take an ibuprofen to somebody on court. And of course, all these cameras, like I didn't, okay, whatever. And then like I went back to the training room and my phone blew up because people were watching like, what did you just hand the player? What did you do? And I was like, what? So I think that, because we're definitely under the microscope more versus at Cirque, nobody really pays attention to the artists. They're, they have costumes and masks and makeup. So they don't maybe really know who they are. The other thing is with sport, there's a season. So there's a preseason, an in-season, and a postseason. At entertainment, it's just year round. And it's quite, you could do like a concert tour and there might be like an end date, but you might be on the road for a couple of years doing that tour. So it's quite unique to think of an athlete, because dancers, performers, acrobats, they're athletes, doing everything 12 months out of the year and no real off season. So those two things are very different in managing I can definitely manage both, but I think, yeah, being under the microscope and then managing the artists that are performing year round with no time off. So those are the two biggest.
Yes, I can imagine getting used to all of the press would be quite an experience.
Yeah, I mean, and I had been at big tournaments, but it was like, wait, what? Like, why are you people like I wasn't prepared. Definitely not prepared for that moment.
So the next question we have submitted is, what is your favorite aspect of your career?
I think the thing that I like the most is helping somebody else. And if you talk to anyone in healthcare, nursing, doctors, that's why they got into the healthcare field. There's something really gratifying about like somebody coming to you with a problem, an injury, and you're the one that helps kind of put the puzzle together. And then, 3 months down the road, the person's back performing. So I think that is the one thing. Also, healthcare is constantly evolving, and there's so much now. There's like technology coming out and like wearables, and everybody's got an iWatch and all that information. So it's really important to become a lifelong learner. Mm-hmm. And I never knew that was something that interested me until maybe like halfway through my career. And I was like, oh, I really enjoy continuing to learn. So being around people who have been practicing longer than me, or opportunities that I can still take more classes, all those things are very important and still gratifying to me.
Yeah, I can imagine that would be a very fulfilling career to have, to see who you've helped to back out there performing.
Yeah. I mean, in tennis, they'll have a court call, you'll go tape them, and they go win, and you're like, yay, I did great. That probably has nothing to do with us, but yay, I helped, those 3 minutes.
That's very exciting. So the last question that I have for you is, what kind of personality or skill set would be a good fit for your career?
Well, I don't think there's like one specific, personality trait. I do think in sports and entertainment, you have to be very approachable. Like nobody's going to want to go work with you if you're cranky or if you're a little bit hard, like with the interpersonal communication, meaning like you can't really build that rapport with your patient, your athlete, whatever. So I think, there's some outgoingness. You have to be able to talk to people because that's how we communicate. For me, like I said, a lifelong learner, because if I were doing things exactly the way I did 20 years ago, I'm going to fail now. Mm-hmm. So I think you have to be adaptable and kind of roll with the punches, especially in sports. We'd have rain delays. You might be on site till like 2-3 in the morning, and you'd been there since 7 in the morning. And that's just the job. There's going to be things that are unscripted or not expected. So I think just, being adaptable.
Yeah, I think, and adaptability is important in so many different career paths. And when you can really develop that skill and become that person that's okay with change, I think that makes a huge difference in your personal and professional life.
Yeah. I mean, nobody really likes change, I would say, but when you're through the change and you look back, you're like, oh, that was cool. Like I learned this, or I was able to do this and I didn't die or whatever. Like, it's just, it's scary because you don't know the unknown, but I definitely think I agree with you. Like it's a good skill.
Absolutely. Well, thank you so much for being with us today. And is there any last minute nuggets of advice that you would like to leave with students?
I mean, I'm a female in a medical profession, and even though there's more females in physical therapy, there's men that I have to deal with. Often the doctors are male. And I just wish that more females would not be so timid and scared of failing and go ahead and take that jump, because, I mean, I think, the women know it all. The females, I feel like we have those skills to adapt and to be able to take the chance. And I just wish more females would get involved in science, even math. I hate math, but I can manage it. So I just, yeah, don't be scared because you're a female. Don't think that you can't work at the NFL, especially now. I mean, things are changing. There's more women in the NFL now, coaching, even at the college. There's a girl kicker, you know? So I just think female should not be the reason why you don't take a chance.
Yes, 100% agree. Hopefully we will inspire some beautiful, wonderful, smart, intelligent ladies to take that risk and, you know, pursue whatever career it is that you're interested in. Don't let anyone ever tell you that you can't.
Exactly, 100%. Well said.
Well, thank you so much for being with us. Thank you to all of our viewers and listeners for tuning in. Be sure and check back next week. We'll have a new industry professional, and we can't wait to hear more about their career. So see you next time.